month in June on Wednesdays, we are talking about Allegheny College of Maryland, and specifically the Bedford County Campus celebrating its 30th anniversary this year. And today's topic of conversation is going to be the nursing program, and they have an absolutely outstanding nursing program that we're going to hear more about. And we have with us today Sherry Obert, who is the professor of nursing, Christy Carbaugh, who is a May 2021 Bedford County Campus graduate with an associate's degree in nursing, so just a recent graduate, Madison Cottle, who is a Bedford County Campus student, just accepted into the Bedford County Campus nursing program for this fall. And I'm also proud to say a graduate of our Youth Leadership Bedford County program. And of course, our friend Leah Pepple, who's the Director of Pennsylvania Advancement and Community Relations. So ladies, thank you all for being here to talk about the nursing program. So Sherry, can you start and just talk a little bit about the overall nursing program at the Bedford County campus, when it was started, why it was started, and where it takes place?
The program was started in 2005. It's actually located currently at the Bedford County Tech Center. There is a separate workforce development building where the nursing program is located. So we're fortunate that we have a separate classroom, computer lab, and then a small skills lab. So we're very fortunate to have that. The program was developed because of the need to have people in the local Bedford County community and also the surrounding areas be able to go to a nursing program that would not be a university, that they would definitely need to go for the 4-year program. The associate degree program and the baccalaureate programs all take the same State Board of Nursing. So if a person would graduate from our program, they certainly can go on to get their degree. Some of the facilities actually will pay to have them complete their degree. So once a person is accepted into our program, there are requirements that they must take. They need to take admission tests and have their prerequisite courses completed, such as their anatomy and physiology, microbiology, some of the different things like math, and that there are those general education requirements. And then once they are accepted into the nursing program, they need to complete 2 years, which would be 6 different nursing courses, and most of those are 9-credit nursing courses. So in addition to the classroom work that they take, they also get clinical experiences, and we are very fortunate to utilize the long-term care facilities in Bedford County. And then also we use UPMC Bedford and Conemaugh-Nice, and that those are the primary areas where we do clinical. So we're very fortunate to have great partnerships with our local facilities.
I know you have a great placement rate as well. So there's such a need for nurses that continues in Bedford County and in the region. So all of your graduates who want a job have one, right?
Yes, we have to keep record of that. We've contacted all of our graduates, and if they want to be employed, that there's an opportunity out there for them.
And Leah, do you want to talk a little bit about how exceptional the nursing program is at ACM? I know they have a fantastic national ranking. Do you want to brag on them a little bit?
Sure. ACM was actually ranked 8th in the state of Pennsylvania by registerednursing.org. And really, I think it speaks to the quality of instruction that Sherry offers and other nursing staff offer to students. That were ranked 8th in the state of Pennsylvania. And this is based on students, the NCLEX scores that they have. Once they graduate, they earn an associate's degree in nursing, but they still have to complete the NCLEX exam to actually be licensed as a registered nurse. So we're really proud of this ranking. And again, it really just speaks to the quality of instruction that Sherry and other nursing staff offer here at Allegheny College of Maryland.
Excellent. And Christy, congratulations on your recent graduation, and you're a full-fledged nurse now. Can you tell us tell us a little bit about your experience as a nursing student at ACM?
The nursing program was a great experience for me personally. It's a trying experience as well. It's very hard. It's hard work. It takes a lot of time and dedication inside the classroom and then the clinical atmosphere as well as at home. So you have to devote a lot of time and effort into the course, but it is very rewarding, even in your clinical sessions at different facilities and with patients, and seeing how what you're learning and incorporating into your clinical skills and in patient care evolve throughout the 4 semesters, and how you grow as an individual and as a team, as a class.
And what are your plans now that you've graduated from the program?
I have actually come full circle. Actually, I have accepted a position at East Freedom Surgical Associates with the surgeon that I worked for prior to returning to school, only this time as an RN.
Wow, good for you. And what would you say to folks who are considering maybe a career change? Obviously, that's what you did, right? Or going back to school, or
Yeah.
starting in a nursing program. What advice would you give them?
There are so many job opportunities available for nursing, and there's a need for nursing at this point in time. I encourage anyone, no matter their age, no matter their circumstances, there's always some way or some boost to help you get through, whether it be through scholarships through the foundation or through student loans. The school is willing to help you find the best suited route for you to get to that finish line. But it's an amazing opportunity. The classes you learn so much. You learn to piece things and incorporate things together, and you evolve as a person, as a student, and as a nurse.
And what did it mean to you to have this opportunity here in Bedford County?
That was such an important thing for me. My family is here in Bedford County. I have 2 children. One is a graduate from high school already, and my daughter who's currently in high school at Northern Bedford. So it's important for me to be able to be close to home and to be able to still be mom, and in addition to being a student. And so that was extremely important. And the fact that it's so financially possible. In many 4-year institutions, and a nursing program is quite expensive and not cost effective for a family, especially for families like myself. I left a full-time position to go to school full-time and devote my full time to my studies. Without scholarships and without loans and without family support, being localized here in this area, I don't think I would have been as successful as I have been.
Well, congratulations.
Thank you so
Best
much.
wishes in your new path.
Thank you.
Madison Cottle, so you have been going to Bedford County Campus of ACM for the last couple of years, and you just got accepted into the nursing program. So tell me why you chose ACM's nursing program.
Well, like Christy said, this is her hometown, and I live 5 minutes from the campus. So for me, it was really important that I could come to college, be able to work on top of it as a student, and also the ACM community in itself is excellent. The entire office has been nothing but supportive, and I'm also a work study student, so I've been able to make really good relationships here. So going into the nursing program, it's nice to have almost a second family that I can be so close to and talk to and feel support from.
What do you want for your future? What are your goals once you attain your nursing degree?
Well, I want to get through the associates, and then after that, I want to go online and get my bachelor's. And I'm not sure what the next few years have in store. Who knows where I'll be 5 years from now? But in a long-term goal, I kind of want to get my CRNA. But like I said, you never know where life's going to take you by then. So we're going to start here with the associates.
Well, congratulations. Best wishes as you pursue that degree. Good for you.
Thank you.
Sherry, can you tell us what students in the nursing program can expect?
Well, as Christy had mentioned, it is very different. The tests that they take are preparing them to take the NCLEX. So it's a little bit different than your traditional general education courses. So they have to be able to apply the theory to clinical situations, so that you have questions and they have what are called select all that apply answers. The other thing, you have to be very good at prioritization. So you would be given a situation where you come on to your nursing unit and this is your assignment. Who do you go see first? Who has the most critical need? So that's a little bit different. The critical thinking, or some people are referring to it now, is the clinical decision making. So that's really a big component of it. And then the first semester, which Madison's going to be getting into very soon in August, would be learning all the skills. So it's very skill oriented in the first semester. That's where you would learn basic needs as to, taking vital signs, learning how to give a bath, passing medications, giving injections, the basic skills that a nurse has to know. And then we get to the more advanced skills in the second year, where they will go to the obstetric unit, and that they would learn how to read a monitor to see, how the baby's doing and the mother's contractions. And then the final semester is advanced medical surgical nursing, more your critical care. So then they would spend a lot of time in the emergency department, also in the critical care unit. So then you need to know how to read an EKG. You need to know how to give the medications that are IV push, that in a crisis situation, if someone was having a heart attack, that you could get the medication into them rapidly to, prevent them from, having a bad outcome.
Thank you so much for the quality of education that you provide, and look forward to seeing all of your students thrive when they've completed your program. Leah, do you want to talk about how folks can get more information if they're interested in the nursing program at ACM?
Absolutely. The campus here in Bedford or Everett is open Monday through Fridays, 8:30 to 4:30. You are always welcome to come here to the campus and speak to us about our programs, including the nursing program. You can visit us at www.allegheny.edu. And this summer, we are holding 2 enrollment days on June 10th and July 15th. If you're interested in coming to the college, but you still have some work to do to get enrolled for fall, come and see us during one of those days. We can help you apply to the college, meet with an advisor, schedule classes, finish up financial aid, and learn more about scholarships as well.
Excellent. Well, thank you all for being with us today on The Vibe, and we look forward to continuing to discuss Allegheny College of Maryland offerings over the Wednesdays throughout June and into July. We do encourage everybody to check out all that they have to offer on their website. And Christy and Madison, especially, good luck to you both in your future.
Thank you for having me.
Look for The Vibe Mondays, Wednesdays, and Fridays on Facebook, YouTube, and BedfordCountyChamber.com. Ask us how you can become a sponsor of this project, and special thanks to the Chamber's Founder Circle members for your community-leading support of the Chamber mission. Thanks for watching, and we'll see you soon.
Did you ever make anything happen? Anything you couldn't explain? You're a wizard, Harry.
I'm a what? Dear Mr. Potter, we are pleased to inform you that you have been accepted at Hogwarts School of Witchcraft and Wizardry.
In a few moments, you will pass through these doors and join your classmates.
Keep an eye on the staircases. They like to change.
Good afternoon, class. Welcome to your first flying lesson. Stick your right hand over the broom and say up.
Up! Wow.
Mr. Longbottom, Mr. Longbottom, Mr. Longbottom, exactly where do you think you're going?
Do you really have the scar? Wicked.
Mr. Potter, our new celebrity. First years should note that the dark forest is strictly forbidden, that no magic's to be used between the classes and the corridors.
Petrificus totalis.
The third floor corridor is out of bounds to everyone who does not wish to suffer a most painful death.
Throw in the dungeon! Understand this, Harry, because it's very important. Not all wizards are good.
I'm going to bed before either of you come up with another clever idea to get us killed. Or worse, expelled. She needs to sort out her priorities.
I think it is clear that we can expect great things from you.
Sally, you look wonderful. What's your secret?
I moved. Homewood, Springhouse Estates. It's wonderful. They take care of everything. The lawn, the appliances. They even changed the light bulbs.
Wait, I thought that place was for old people?
No, 55 plus. It's wonderful. They even have planned trips. I don't have to worry about my house anymore. Now I just worry and take care of me.
I'll have to check it out.
Homewood, Springhouse Estates, the best thing I've ever done.
Plumbing, done right. Since 1947, we have always been there for our neighbors and friends. Reliable, prompt, and always done right. Our name, our work, our promise. We guarantee it.